Hi there, my name is Dan Bergholtz. I founded the Miami Street Medicine team, and today I want to show you how I pack my bag. Alright, so we'll just get started with the bag itself. This is a 28-liter backpack. I believe it's called the Mardingtop. You can get it on Amazon for 40 bucks. I've definitely tried more expensive bags, I've tried cheaper bags, and this is the one. It has a lot of different compartments in it, and you can also make use of the MOLLE system where you can add attachments kind of as you see fit. So now I'll show you what I keep in these different compartments. Starting with this outside one here, this is a bag of medications. So this is prescription meds, over-the-counter medications, and this can kind of detach as needed, self-explanatory. Then over here, I've got an attachment. This I actually use for garbage, so I line it with a biohazard bag and then can kind of dump trash in as needed. And then once you're done with it, it folds up very nicely and just packs away. Here, I keep a blood pressure cuff, and I also keep a glucometer. I think these are extremely useful. Big thing we're doing on street outreach is kind of identifying things early, like chronic diseases and stuff. Always want to keep those with you if you're doing street medicine. Up next, this I keep some kind of like foot care items. The feet are exposed to all sorts of elements when you're living out on the street. So foot powder, some podiatry tools, as well as, they're combined with an incision and drainage kit, some various antifungals and creams, and foot powder. So try and keep that as well, because it's definitely a need of our patients. Usually before street outreach, I'll keep some fresh socks in there as well. Up top, this is a more free use kind of spot, and what I put in here changes kind of week to week. Right now I just have some gloves and some note cards. It's always a good idea once you're done with a patient encounter, kind of write out what you talked about, anything you found, and hand it to them on that pocket-sized note card. But there's not much in there for me right now. In the side pocket here, I also keep some hand sanitizer. Whoops. I also keep some hand sanitizer. So this is good. We want to maintain good hand hygiene while we're out there. That also reminds me, it is really important to have a cloth bag. Whatever kind of bag you have, something that can be laundered afterwards is really important. Flipping to the other side, some saline wash, and this is really important for wounds, although, tap water actually works just as well. So you can have a regular bottle of water there if you want. One thing I love about this bag is that it folds flat, or it opens flat. So you can just flop this open, and now you have access to kind of all of your different components here. Again, it varies what I'm gonna put in here. Sometimes if I've made an agreement with a patient, like that I'll bring you a shirt, for example, I'll put that in this pouch here. Up here, I'll often keep some harm reduction supplies or things that maybe we want quick access to, like Narcan, as well as a pair of goggles, which is important if you're washing a wound, to keep kind of your safety gear on. You'll notice I've got different packs here. I highly, highly, highly recommend when you're packing your bags to, in the main container, keep things separated in a system like this. This will help keep things dry when you are exposed to rain out there. It will also help keep things organized, and you'll be able to pack a lot more in your bag. Alright, so now that we're looking inside the bag, you'll notice that I've got some different pouches here, and that helps me keep things organized. I usually bucket them into 3 different categories. One being more vitals, diagnostics, maybe some consumables, reference guides, more of a miscellaneous category. Another being derm and skincare items, extremely important. And then lastly, we've got our medications. So to kind of pull up the medications, this is, by the way, in the bottom of the bag for a reason. It's if you have temperature sensitive items like, let's say, insulin, or you have A1c tests. This is here so that you get less sun exposure and it's less prone to temperature fluctuations. But as we check out the bag, you'll see that I have a lot of medications in these little baggies, and I really recommend pre-packaging your meds so they're easier to dispense in that way. And they're also, you know, I actually wouldn't do it like this where you bring out the whole bottle. It just makes it a little bit harder on the street. But it seems in this instance I did that. Keeping a number of, again, little pre-packaged items that you can give out, I think that's very helpful. We've got basic over-the-counter medications, some PPIs. We also have a portable hemoglobin A1c, some Narcan, some wound or wart treatments, cold and flu medicines, Tylenol, some blood pressure medications, metformin. These are the common things that you'll need, and I'll put a list in the description as well. Moving over here now, we have the wound care supplies. This is really important to protect it from rain. I think it's also good to have a variety of different dressings and many of them. Nothing feels quite as bad as running out of dressings. Also keep a suture kit in here. Things are kind of exploding. Also keep a suture kit, a suture removal kit, some lidocaine, chlorhexidine, skincare, ointments, hydrogels, and then a variety of different dressings. Foam ones I think are some of the highest yield dressings you could use. And then some secondary dressings like these gauze rolls. Those are always good as well. Kind of have some various things, steri strips and Vaseline as well. Those are often very handy. And then lastly, we have our diagnostics pack, as I guess we can call it. This will have some of the things that you need to take vitals. Now, our team has an ultrasound, so we keep that here along with some single-use kind of ultrasound gel packets, a thermometer with disposable probe covers. That's always really good. An otoscope and ophthalmoscope. Also keep a reflex hammer. This detaches. And then just some various supplies like condoms and eye drops, band-aids. Keep a pulse ox, toothbrush, some 3-0 Vicryl, some monofilaments for doing diabetic foot exams, a little stopwatch sometimes you need for taking vitals, prescription pad. This is like a screening for intimate partner violence, something that helps you identify lesions. So this is more like a miscellaneous bag, but highly recommend you keep kind of your vitals and diagnostics here as well. All right, so you've seen what's in my street medicine backpack. Now you know how to pack yours. These are the essentials that will come out with me on almost every outreach, as well as hygiene kits, socks, water, food, in a tote bag that I would bring along as well. If we're going out with a team, we'll have another backpack that's got some more advanced diagnostic equipment, some more medications, and things specifically tailored to the particular patients that we're trying to find that week. Overall though, you really can't go wrong with good wound care items, some chronic disease management, and a stethoscope. Really, at a certain point, the stuff begins to become a distraction. And really what we're out there to do is to listen and build a therapeutic relationship so we can connect people to a higher level of care than what we can provide out on the street. So most important is to just go out there with open ears and an open heart and start from there. We'll start with the bag itself here. This is the this is the Mardingtop 28 liters. It's by far my favorite bag. I've